annual Baltimore Week. Each year, the first week of October serves as our Baltimore Week, where we highlight social justice issues and work being done collaboratively in Baltimore. So this event really does put the icing on the cake of not only an amazing week of conversations about social justice, about community involvement, about change here in Baltimore, but it is the last of our 15th Baltimore Week. This is the 15th anniversary of SOURCE, the Service Learning and Community Engagement Center. So it is my delight to bring to you this panel conversation, Power, Privilege, and Public Health, Codifying Safety. We have a remarkable a group of panelists for you today, but I want to take a moment and really kind of level set before we get into the content. So I'm going to start with an acknowledgement. I want to acknowledge the Piscataway tribe, the indigenous peoples who are the traditional owners of the land of the Chesapeake Bay region. I also want to acknowledge the impact of racism, of systemic oppression, which includes the practice of redlining, colonialization, genocide, and state-sanctioned violence in the lives of Black and Brown folks, especially here in Baltimore. As I said, this is the last event of Baltimore Week, and we are really excited about the conversation that's going to commence. And we'd like to be able to share it with folks who couldn't be with us today. So I'm going to ask you to engage with the resources that you have in your panel tab of letting us know if we have your permission to record today's session. If you will grant us permission to record, please select yes, and we'll modify based on what the responses are. You can find the option. I see some thumbs up. I see people selecting yes. Brilliant. I don't see any no's. So I'm going to move forward with recording, and I want to also use this time to say a deep thanks and appreciation to the SOURCE team for their support this week, to Lydia, who is the Federal Work Study student working alongside me to coordinate this event, and to Azad, who's been an amazing technology administrator. So thanks to everyone for the yeses, for agreeing to record. Azad, feel free to move forward with recording. I see the red light, and I think that means we're ready to go. All right, I have another announcement. That is, it's voting time. And if you're not registered to vote, we want to make sure that you get the support that you need, not only to register, but to create a plan of action. Do you know how you are going to move your vote forward? If not, there are folks who are excited, willing, and happy to help you with Hopkins Votes. So we're going to drop the link to Hopkins Votes in the chat. Feel free to click on that link, get yourself registered to vote, and put together your voting plan. This is a really important election for more reasons than one. And as I always say, vote early and vote often. And now I'm going to lead us in a little bit of grounding. We're going to be talking about some topics that might make us a little uncomfortable. We're going to be using language like racism, white supremacy, and that might make us start to feel discomfort in our body. And that's okay. It's our body's way of letting us know that we're reaching an edge, a learning edge, a developmental edge. And that discomfort is something we should lean into so that we can continue in our growth and development. So in order to do that, I want you to use the power of your breath. Your breath is a great way to reduce the amygdala hijack that happens and moves blood away from your logical mind into fight, flight, or freeze. I'm going to ask you to use the breath to come back into your present state and ground yourself so that you can be a part of the conversation. You can think critically. You can engage with new ideas. So in the moments where you may feel disrupted, in the moments where you may feel discomfort, engage with that breath, and then you will find the ability to remain present and remain a part of the conversation. That being said, we want to make this place, the space that we're sharing, as brave as possible. And we're going to agree to do that by deciding what the culture will be. These are some foundational agreements that I use often, and I invite you to add to them if you feel like they aren't sufficient. Not just now, but even as we go, you can use the chat to add to these agreements, but I'm going to walk us through them. I want you to feel engaged. This is a conversation after all, and we have an amazing panel, but we also are mindful that you have lived expertise, and those are welcome in this space. So feel engaged, remain a part of the conversation. Use the chat, use the indicators in the participant tab to share hand claps and hand raises and links even. This space is for all of our learning. Smile. Just like breathing can be a way to bring us back into our body and help us ground ourselves for continued engagement, smiling can do the same thing. So all smiles are welcome here. Use it early, use it often, just like your vote. Make space, take space. This is a reminder of how much we're contributing to the conversation. We want this space to be a practice for the future that we all want, a place for liberation. And in order to do that, we have to be mindful of how much space we take up and invite other people to be a part of the space, because the space is richer when we're all contributors. So I'm going to ask you to be mindful in the way that you show up in this space, to make space for other people. Maybe you don't put all the comments that you wanted to put. Maybe you don't put all the links that you wanted to put. Maybe you don't post all the questions that you want to post. Hold space for other people. Allow them to be a part of the conversation and the contribution as well. That being said, when you're adding your thoughts, when you're sharing your opinions, I'm going to invite you to use some language. Yes, and. This ensures that we don't nullify the experiences, thoughts, and opinions of other people, but we contribute to an emerging space where, again, we are all the fullest expressions of ourselves and we all are welcomed and present. Impact over intent means we're going to be mindful with our words. Though we may be well-intended, our words at times can have a negative impact. And being mindful of that means that we choose our words wisely so that we can get across our point, but we do not nullify the existence, the thoughts, the opinions of other people. Learnings leave, stories stay. This is an attempt to create somewhat of a respect for confidentiality. Ultimately, I want you to leave this space with an enriched learning experience that you tell other people about. But if it's not your story, I'm going to ask you not to tell it. Leave the stories that you hear here, and that gives us all the freedom to share and be vulnerable and be brave by sharing our own stories. And then own your mental liberation. This brings us back to that learning edge. There may be things that you hear, there may be things that are posed in the space that are new for you, that are uncomfortable for you. And that's okay. I want you to engage with those, because ultimately moving towards them means that you are investing in your mental liberation. You are learning new things and behaviors and thoughts that you can carry out into the world and again, create the future that includes all of us. So with that being said, if you agree to these agreements, feel free to drop a yes in the chat. Feel free to use the yes button. Let us know if you're on board. I see the yeses pouring in. I love it. Thanks, everyone. Again, you have lots of ways to participate. We invite you to create continued conversation and corresponding conversation in the chat. And then, of course, you have the amazing buttons inside of your participant tab that allow you to indicate that you have a question or that you agree with something, right? Use those. Let's make this space deeply interactive, even though we can't be face-to-face with each other. So this is the wrong set of objectives, but we'll just keep going. Our goal for today is to really examine this conversation around safety. Safety of the law is that codified safety, and recognizing that we're in a moment in time where we're having conversations about if that law and those who move it in, embody it and move it into action are actually considering the safety of all. So we're going to start this conversation by looking at a clip that really sets the stage on folks voicing their opinion about the fact that systems of safety were not necessarily designed for them. And then we're going to have a panel conversation that will allow us to talk about safety in different ways, to unpack it and discuss safety and health, safety through the arts, safety in the ways that we agree to be together. And we have an amazing group of panelists that will help us do that. So let's foreground this conversation with a clip that really is the reason that this panel is happening, a conversation around the role of Black artists and discussing racism through their art in the United States.
This is not new. Police kill roughly 1,000 people every year in America, killing black people at double the rate of other victims. The pleas to stop the killing were ignored for decades. So tonight, right now, we report on why, on the voices demanding change to try to inform the path ahead. So we begin in 1963, as Dr. King led the March on Washington against segregation and racism, and singer Sam Cooke that year was barred from a hotel because he was black, and then arrested for objecting. Afterward, Cooke wrote "A Change Is Gonna Come," saying he was moved by that incident, the protests, as well as Bob Dylan's "Blowing in the Wind." Like this year's protests, the song pleaded with America to confront government racism and violence, recounting personal hardship and also hope, making it a civil rights anthem. Did Cooke predict the change or drive it? Well, the song brought Jim Crow and its realities in front of more Americans, just as Billie Holiday drew attention to lynching with Strange Fruit. Those haunting words echo like horrific poetry. Holiday adapted that song from a political poem by a labor organizer, pushing 1930s Americans to face the lynchings of what is now a total of over 4,000 black people. Despite corporate pressure to censor that song, Strange Fruit actually became her highest-selling record. Those black artists, aligned with activists, were drawing attention to racist realities that many ignored. They led us here, so we should really listen and learn some of their lessons, from Sam Cooke to Grandmaster Flash, who recounted life inside the concrete jungle in his 1982 anthem, The Message. That music video ends with police harassment and this unlawful arrest. And just as NWA shocked 1980s America with the aggressive anthem, F the Police, let's listen to what was being said then as it echoes now. That song wasn't against the concept of police. It was against the system's routine racial profiling and killing. It recounted police harassing brown people and police thinking they have the authority to kill a minority, a point that's literally echoed today as protesters quote those very words like earlier generations quoted Sam Cooke. But in the Bush-era 80s, the anti-police anthem by NWA was actually banned. It was attacked by the FBI, which rebuked the group for disrespecting law enforcement, even warning its label that the FBI opposed the song and its message. Fact check. The FBI can't control free speech, and it's not supposed to spend your tax dollars writing album reviews. Many artists pleaded with America to see and believe and react to the reality of police brutality, from Wu-Tang Clan recounting cold-hearted killers with blue suits slaying our black youth, to KRS-One highlighting real footage of police beating protesters in an iconic song, arguing that while many white Americans may see police as protectors, a source of safety, many black Americans live in a reality where police are the source of danger. That's why KRS-One told us people fear the very sound of the police. That iconic 1993 song says that the modern police system replaced plantation overseers, arguing the overseer had the right to get ill and the right to kill. The officer has the right to arrest, and if you fight back, they put a hole in your chest. That was 25 years ago. KRS-One stressing the racist historical framework for modern justice, a once perhaps radical view that's now central to the political focus today on structural racism. The 90s also saw a rise in home videos that confirmed these same stories. Rappers like Sister Soulja and Tupac stressing how the system would ignore even hard video evidence. And as many demand today that we say the names of so many black people killed by police, we should listen to how artists have been doing that for years when others weren't paying attention, memorializing the lives and the names in a tragically long list of songs by Prodigy, The Game, Nicki Minaj, Kanye, Jay-Z, Wyclef, Papoose, and many, many more I don't have time to mention. So how did America take in that storytelling? The names, the facts, these sad, recurring realities. I want you to think about this tonight because it's important. America did not take it well, which brings us to another part of tonight's report. And I admit, we're already detailed here, but this is important for the road ahead. Those stories told by black artists and activists were often met with two reactions. From the police, black artists' criticism of police brutality was met with police brutality, a crackdown we've seen in protests this year as well as in decades past. And then from the broader political system, a different crackdown, which I'm going to show you. So let's go all the way back to Sam Cooke, where we began, who'd faced discrimination that inspired his very song. Well, we must also remember that while change did come, it was not in time for him. Activists were literally quoting his song on signs and posters in 1964, marching his words in front of America. The Voting Rights Act passed next year, but by then, Cooke was dead at 33, shot by a motel manager in a controversial incident that authorities ruled a justifiable homicide, which was widely contested. As for Billie Holiday, she died in a hospital where police were trying to hold her for drug charges, handcuffed to the hospital bed. Cruel measures so severe that a court ordered police out of the room for her final hours. She was 44. Now, some might think that was a long time ago, but every other recent artist quoted thus far tonight has also faced documented discrimination. Police harassing NWA and pulling out shotguns for Wu-Tang Clan, which they told America about in the very first year they got famous on Arsenio.
Next thing I know, I look back, I see like 3 cop cars, they're radioing in for backup. They got shotguns and stuff pointed at us. So I'm thinking this. Hold on. We're all outside now. They got us on the concrete with our faces down on this hot concrete.
Whether you're successful or unsuccessful, I'm saying, if you kind of got this tone of skin, I'm saying they're going to kind of really bring it on you. So it's just the same thing everybody else be going through. It just happened to us.
Same thing everyone was going through. And later, police arrested a member of that group for charges so flimsy that even in 1999, a grand jury, which legally tends to approve virtually any proposed indictment, voted down the proposed charges, as a lawyer explained in an appearance with the rapper ODB and his mother, who says she's used to this.
A Kings County grand jury voted yesterday to exonerate Russell Jones of all wrongdoing. Clearly, the incident did not take place as reported by members of the New York City Police Department.
I gave them a cell phone for Christmas, and they thought it was a gun.
No, I didn't have no gun. I don't use guns.
What's it like as a mother to see all this going?
Well, I'm used to it. I'm used to it by now. You know, all I do is I pray.
I'm used to it by now. It was the same out west where Tupac, who was the son of a Black Panther activist, found that his songs about police harassment were met with a police chokehold that led him to sue the Oakland PD.
They were charging me with jaywalking. Next thing I know, my face was being buried into the concrete and I was laying face down in the gutter, waking up from being unconscious in cuffs.
Next thing I knew, I was passing out.
You're suing them.
10 mil.
We'll see
what else
happens.
can I do? You know, we'll see what happens. You know how that go.
Yeah.
Rodney King still fighting for his, and they got it on tape.
They had it on tape in 92. We have it on tape in 2020. Why weren't we listening? You had those police officers, some of them, cracking down. But police power stems from a wider system. which not only ignored those artists' accounts over and over, on tape or not, documented, they all ignored it and attacked it at the time and tried to make hip-hop an example of something terrible, turning the tables to attack the artists.
Hip-hop has done more damage to black and brown people than racism.
It's just despicable. It's outrageous. It is filled with misogyny.
Many young blacks are unsupervised and prone to imitate bad behavior, like what Lil Wayne puts out.
Now, we just showed you clips from Fox News, but let's be historically clear and accurate. It went way beyond just the right wing. While right now some stories of racism and policing are getting more of a hearing, let's recall this was a bipartisan attack on black artists and rappers, with the leaders of both parties elevating it to a presidential issue, from George Bush and Bob Dole on the right to Bill Clinton, listen for it, literally likening Sister Souljah to David Duke.
A line has been crossed, not just of taste, but of human dignity and decency.
The kind of hatred that you do not honor today.
From songs about killing policemen and rejecting law.
If you took the words white and black and you reversed them, you might think David Duke was giving that speech.
That was a kind of political consensus. It was incorrect. And it also helped repress these stories of police brutality that America is still trying to reckon with, to such a degree that in 2020, many Americans view the reports of police killing black people for no reason as a newer revelation decades later. It's a revelation to some because people didn't listen before, didn't believe. And now more people are believing. Now more people are seeing the reality of black lives narrated by black artists and activists, saying the names of black lives taken. So America might someday finally act like Black Lives Matter. A lot of this comes down.
Okay, so this clip sets the stage for an amazing conversation with our panel. And this is the part where I stop sharing my slides so that you can see our panelists all laid out. I'm going to introduce the panel and we'll have a conversation. As you listen to our conversation, feel free to add questions to the chat, and we'll have a segment at the end where we will highlight your questions and make this more than just me talking, honestly. So first, I have the pleasure of introducing Dr. Kali-Ahset Amin, who is an interdisciplinary social scientist, exhibitor, exhibition curator, and an organizational strategist. Her scholarship and intellectual activism focus on racism, Black subjectivities, and urban inequities in America. She's an assistant researcher professor of sociology and an associate director of the Billie Holiday Project. Also with us, and welcome, Kali-Ahset. Also with us is LaToya Peoples. LaToya Peoples is a multidisciplinary artist and educator working at the realm of mixed media, visual arts, and public community art. Her work focuses on figuration, natural elements, color, and pattern as a way of exploring identity and history. She carries these themes over to her mural and sculptural installation work, creating transformative pieces guided by youth and community. Her commissioned works live in the collections of the University of Maryland Medical Center, the UMS School of Virology, the Denver Urban Arts and Venue, and Baltimore Office of Promotion and Arts, as well as the Baltimore Department of Parks and Rec. Thank you so much for joining us, LaToya. We also have with us PhD candidate Kelley Robinson, receiving a Master's of Science in Nursing, who received her Master's of Science in Nursing from Yale School of Nursing, and is privileged to serve women as a certified midwife. Prior to her nursing midwifery, Kelley was a professional educator and used her practice and teaching skills to serve as a clinician. She has a passion for improving health outcomes for women who are marginalized globally and continues to work for change in the areas through her doctoral research, and is committed to promoting equal access to quality women's health care from birth to senescence. Thank you and welcome, Kelley. And then we also have with us Dr. Chidinma, who completed her BA from the University of Pennsylvania and her PhD from Johns Hopkins Bloomberg School of Public Health. She is an assistant professor of medicine at Johns Hopkins University at Johns Hopkins Medical School with a joint appointment as an assistant scientist in the Schools of Public Health, the Department of Health, Behavior, and Society. Her scholarship utilizes community-based participatory research to focus on the work and the knowledge cultivation of community health workers and health equity through community partnership. Additionally, she serves as the Associate Director of Stakeholder Engagement for Johns Hopkins Center for Health Equity. Welcome so much, Chidinma. Okay, so to the panel, each of you is uniquely positioned at the intersection of art, health, and safety, and for BIPOC populations. So the questions that I have, some are specifically for you and your work, and some are broad and open to all. I'll be sure to announce before I ask the question. The clip that we just saw illustrates the ways that state-sanctioned agents of safety have for generations prioritized the safety of white people and property over the safety of BIPOC lives and well-being. And today we're going to specifically name Black people because we recognize that when the marginalized experience of Black people are centered, it actually illuminates and provides concentration for the lived reality of all marginalized people. It is on the backs of movements around the Black lives, such as the civil rights movements that we see, elevation in issues for other marginalized groups, such as the disability rights movement, the LGBTQ+ rights movement, women's reproductive rights, and immigration rights. So that being said, I'm really curious for each of you to talk a little bit about the clip, because we recognize that Black individuals in particular have been curating new stories about themselves, even only amongst themselves. So I'm curious, in light of the clip, tell us how your work tells and addresses the unheard stories of Black people in the Baltimore community. And maybe I can start with LaToya.
Hello, everyone. Thank you for having me. So while I was watching the clip, it was sort of bringing back like lots of memories, sort of seeing these artists and then sort of rediscovering these artists and the things that they were saying as an adult, because I was pretty young when a lot of that was going on. But it made me think of a project that I did in 2018 at the end of the year at the University of Maryland Medical Center in their behavioral health unit that they were renovating. So the behavioral health unit is serving people who are having mental challenges, psychological challenges, and they serve a majority population of BIPOC people in Baltimore and surrounding areas. And it was the first time this University of Maryland health system, but it's also sort of a trend in hospitals around the country where they're bringing in public artists to create work inside of the hospital ward. So this is something they've always done in sort of children's hospitals and children's wards, but they're sort of bringing this idea into where they're serving adults. And it made me think of that project because it's really a departure from sort of traditional thinking about how to serve people within like their treatment, and sort of what we think of hospitals as sort of this white walls, very empty, sort of just very plain, uninspiring environment for their treatment. And it's a departure from that traditional thinking and moving into a space where hospitals are realizing the relationship between art and that type of inspiration and health outcomes. And so, can I share my screen? Is that possible? All right, I'm gonna share my screen. Okay, so here's some images from that project. And these are actually in the hallway, the hallways of the ward, in patient rooms. And a lot of the themes we're talking about growth and change. Again, these people that were going to be served here were dealing with all different types of psychological challenges, substance abuse challenges. So a lot of imagery around growth and working on oneself and peacefulness and that type of thing. And so in terms of untold stories, you know, it made me sort of trigger the untold part of it, because after I finish this project, I will likely never see this work again. But I know that it's reaching people who really need it. And I was a part of a team of 6 other artists, so there's 33 pieces of artwork in this one ward that I think will serve about 27 patients at a time. And so that when you talked about the untold story, it just sort of made me think of all of these, sort of imagine all of the ways that that work that we did is reaching people now and intersecting that art and health, and hopefully creating a really therapeutic environment that then goes on to help these people change. So.
Yeah, thank you so much for that. I'm curious to hear from Kelley in your work. Talk to us a little bit about the untold stories in your research.
Sure, but first of all, those pieces were amazing. They are amazing, absolutely amazing. So thank you for sharing those with us. So it, like LaToya, I watched that clip with a sort of a lighthearted spirit, remembering that time period in my life when those songs came out, the videos that came out during that time, and me coming into my own around that time, but also remembering how just how moving it was to be a part of the rap life, if you will, at that time. Not rap life in terms of me being a rapper, but just experiencing rap in those earlier days. And so, you know, it was great to be part of that. It's also saddening that we're still telling these same stories through our music, but grateful that we still have the opportunity, and that it gave way for more voices to be heard, for more artists to become more comfortable in expressing themselves. And then just letting the world know what our issues are as Black people. So I'm glad that Ari took the time to put that piece together and share it. I come to this place as a nurse midwife. I have been practicing for over almost 20 years now. And I've had the opportunity to practice in a variety of settings. And as a nurse midwife, we often talk about the artistry that goes into it, using our spirits, our heart, and our hands as we provide support for people who are pregnant and experiencing labor and birth. And so in my practice, I've been able to care for and support a lot of people in a variety of settings. And I think for me, what's been most disheartening is the fact that those of us who are often marginalized look like me. And I struggle with that. I struggle with it caring for them. I struggle with it working alongside my colleagues, sometimes being the only Black midwife in the space. I've struggled with it since I've been at the School of Nursing in my research program and practice, understanding research and hearing that we are disproportionately more likely to have this disease or that disease. So because of these things, I think it's all fuel for the work that I'm doing, which is looking at housing instability and how it impacts maternal morbidity for people who are pregnant and experiencing that social determinant at that time. And it's a multi-method study, so it includes qualitative piece where I get to lift up the voices of those who are actually going through this. And of the few interviews that I've done so far, these people look like me. And so I'm excited to be able to raise their voices and put forth to policymakers and to those in the research community what these issues are and tell their stories authentically, which is the goal with where I'm going with this research. So thanks.
Yes, thank you. We're talking about research and talking about the goals of bringing voices to bear in the space of health professional services. And so I'm curious, Chidinma, can you talk to us a little bit about the voices that your work highlights?
Sure. And before I do, I just want to say I really appreciate everything that both LaToya and Kelley have said. What you guys have shared really resonates with me, especially because I love music and I've been listening to rap for several years. If you can't tell by my name, my family is of Nigerian descent. My parents are immigrants. So, and I've always viewed rap as a form of storytelling. That's as legitimate a form of storytelling as any other modality that we tend to value in this society. So when I think about the stories that are unheard, I go back to when I first came to Hopkins as a student. I went to Penn undergrad, like as Kiala mentioned in the introduction, and one of the things that really struck me about my experience there was that that actually played a role in my interest in doing community-based work, was that the West Philadelphia community had such a tumultuous relationship with Penn as an institution, where on the one hand, many of the residents were employees at Penn, but on the other hand, Penn had worked in cahoots with the city governance to kind of help gentrify that neighborhood. And in fact, West Philly today is so different than it was when I was a college student a mere 17 years ago. So, and when I think about the stories that I've heard in the work that I've done with community health workers and the interest that has grown over time in really thinking about how to incorporate voices of those who have kind of been systematically disenfranchised from research, from healthcare, and from a lot of the things that we have really solid entry points into. One of the things that I love about the work that I get to do with CHWs is to start to consider communities as not just places of dysfunction, because that's what we tend to think of when we think of East Baltimore or West Philadelphia or North Philly or certain neighborhoods in Boston, which my parents and family don't live in Boston, but they're all in Massachusetts. And instead to really view them as places of innovation and creativity, where we partner with people and leverage assets within communities so that we can advance health equity. And I feel like community health workers are at the centerpiece of that. And a lot of ways, because they don't have the formal credentialing of some of us on this call or on this Zoom meeting, they are sometimes more trusted than we are, sometimes more trusted than I am. And the stories that they hold or create space for people to hold are really remarkable about the things that when we talk about social determinants of health and we have all these fancy terms, these are people whose lived experiences exemplify the struggles and the competing priorities and the reality that a lot of what we think of when we think about health is kind of based on an upper middle class ideal. And so the stories that community health workers hear about the difficulties people have navigating the health system or different social services, challenges that they may be facing within their families that on the outset or to the naked eye may be regarded as non-adherence, but in fact may be rooted in something completely different that they may not feel comfortable sharing with the healthcare provider. So then when I think about the work that I consider myself privileged to do, I don't see I'm not a community health worker, and I can't speak to everything that they do. What I hope that my work does is amplify their work, and that by doing so, it amplifies the experiences of the patients that they're serving. So that's kind of it in a nutshell, but that's what I think about when I put all of these things together between the video and the research that I've been doing for the past few years.
So rich and so valuable. We've heard about art as a container for facilitating health and well-being. We've heard about the role and responsibility of healthcare workers to center the lived experiences of those who are most marginalized, and thinking about disrupting the middle-class standards that we put around the social determinants of health, and instead engaging with folks who are seen as experts in their community. They live most proximal to the issues, engaging them in this process of helping people find well-being. This is already so valuable, So now I'm excited to come to Kali-Ahset and hear about your work and the way that your work amplifies stories.
Okay, thank you so much. It's been a pleasure. Everybody's doing such interesting work. And I'm also very pleased to question on the other half of this campus to be very seldom do get to have dialogue like this. So thank you for, I'm in a little bit of a different direction because I did have reactions. So I didn't know who are before us.
So Kali, we're having Kali-Ahset, we're having a little bit of a challenge hearing you. And I think it might be the connection.
See.
I also don't have an image for you.
I'm going to hotspot.
So we'll just give a minute.
No, darn it.
We'll just give a minute for you. This is the nature of the live reality that we're in. Zoom makes everything a little challenging, and we'll roll with it and definitely come back so that you can talk to us about your work and the stories that you're highlighting in that work.
Can you hear me better now?
So much better.
I went to my phone hotspot. This is what happens when you have children who are also in school at the same time, taking up the bandwidth. So, hopefully things will remain stable. But I really, and I'll just sort of zoom through since I've lost a little bit of time here, but I really wanted to respond to the reportage itself as my entry point here. Because I wondered sort of at the outset, why does he call the segment a special report? What exactly did he want to achieve, and who were they trying to reach, Melber and the producers? Despite his positioning as narrator, the piece makes an effort appropriately to center Black artists and their art as protagonists of Black struggles for justice. And I think that's very important visibility. Yet, Melber sits juxtaposed to those images of artistic protest while he interprets for his predominantly non-Black viewers what these protests mean and why they matter. And all this, of course, with the legitimizing background specter of the NBC Peacock and the Washington Capitol. So you have to forgive me, I'm a sociologist, so I go to this place first. So I think the piece represents a more responsible journalism in some ways, but it was problematic for me in other ways that I think are relevant to our conversation, primarily because the clip reinforces throughout the spectacle of Black death and pain and constant assault, which is frankly an imagery that I'm constantly working to protect myself from, right, as a matter of mental hygiene and self-preservation. And I raise these points not so much in criticism, but as a sort of deconstruction of the storytelling itself that I think is important, because it leads us to the question of audience and endgame. Who is the history lesson intended for, right? And to the sort of broader framing of the conversation about power and privilege, how does the social positioning of the storyteller facilitate or work against that message being heard? So, you know, the Melber piece doesn't necessarily enlighten me, as I've suggested, kind of damages my spirit. It's not for me, and that's okay. But this issue of the relationship between narrator and audience extends out to one of our central questions today, I think, which is that of the relationship between the artist and the people, and the role of art and the well-being and preservation of the people. And I have a good friend who says that the role of the artist in communities whose backs are up against the wall is to translate the longings of the heart of the people. I'm going to repeat that because I really like that. The role of the artist in communities is to translate the longings of the heart of the people. And this imperative, when it's fulfilled, is a liberatory expression. Now, if the role of the artist is to translate the longings of the people, then the role of the activist is to channel that righteous rage of the community through action that can affect change. And when you join these efforts together, the artist as activist then asks, as I translate the longings of the people, how can I help them to see a future and a possibility that is beyond their everyday struggle and pain? How can I help them to see themselves as worthy of the struggle? How can I help amplify voices, right? So that people can hear their own voices even more clearly on their own terms. So if we want to talk about unheard stories, the question becomes, who are we suggesting is not doing the hearing, and why? So in times of social upheaval like now, I think there are at least two conversations, indeed movements going on always at the same time. There are movements shifting social currents, if you will, among the vanguard of the oppressed group, and the artists are often at the vanguard, right? These shifts are happening simultaneously in the realms of art and politics and ideas. And then there's another kind of conversation happening between Black people, in this case, and the rest of the world. And it's in those spaces of encounter where interpretations of Black protest and protest art are mediated by white interlocutors and power structures, like the media and the government. But also, as we saw in the clip, by Black elites and a political class and other people of color serving as gatekeepers of both respectable art and acceptable forms of protest. And it's a roundabout way of getting finally to some comment on Billie Holiday, the namesake of my institute. I'm the associate director of the Billie Holiday Project here at Johns Hopkins. And her clip of her protest song, although you didn't get to hear it in this playing of the video, her song Strange Fruit is known as a really significant protest song for those of you who don't know her. And Holiday was a Baltimore native. She was born in 1915 and died tragically in 1959. She was known then and now as one of the most legendary and iconic voices of jazz music, not least because she seemed to take all of the pain she experienced in a very hard scrabble life in Baltimore and transform it into a sound of really indescribable beauty. But it was beautiful not because it was pristine in some sort of abstract sense of operatic purity. Rather, it was beautiful because it emoted the pain of the Black masses, the aspirations of Black youth, the grit of the Black woman, the collectivized sense of loss and hope that really spoke to the early and mid 20th century Black experience under the thumb of Jim Crow. So here's what I mean by that internal conversation going on among people at the margins who have little left sometimes but their dignity, and who rely on the artists of their community to be a voice and a mirror for them. So Strange Fruit wasn't written by Holiday, but it was popularized by her when she recorded it in 1939. And the song references a multiple lynching of teenage Black boys that took place in Indiana in 1930. I really encourage you to listen to the song if you haven't before, or read the lyrics, because its lyrical power, coupled with Holiday's interpretive genius, I think really made it an exemplar of art that collapses the distance between narrator and audience, and through the embodiment of Holiday herself, presents a way for Black people to release our rage peacefully, right? And it presents non-Black peoples a way to really see the truth of racial terror for what it does to both the Black body and the white soul, as James Weldon Johnson, a Harlem Renaissance writer, so famously remarked. So yes, to the point of the video, Black artists have been speaking to these issues since time immemorial. But I would submit also that the goal of resistance art is not only to sway white public opinion, and in fact, that is often not the objective at all. Rather, protest art exists to help Black people commune with each other and to heal ourselves through the voices and paintbrushes, LaToya, of those who have been listening and paying attention the whole time. So what we do at the Billie Holiday Project is to archive these art traditions within Baltimore, record the memories of the city's art makers, and try to carefully preserve and find ways of sharing these traditions and histories for broad consumption.
And this is why we need more than an hour and 15 minutes. This is a conversation that could go on all afternoon, right?
I'm filing with the agreements.
Yes, along with the agreements, I should be shorter next time. I think what you've shared with us, Dr. Ahset, is an important segue into a conversation around the clip makes this juxtaposition about who gets to be safe and what safety looks like and for whom, right? But what you just shared gives us this concept of creating safety for oneself, right? And art being a space for that. I'm curious about the work around the art of healthcare and creating safety. Kelley and Chidinma, can you talk to us a little bit about the way that you are using the art of healthcare to create safety for marginalized women, people, I should say?
It's so funny you say that. I was taking notes because I love how Dr. Ahset said that artists translate the longings of the heart of the people, and that the activists channel the rage. And I wanted to, if you could put in the chat the last piece of the activists, because I want to make sure that I take away from this conversation all of that, because the years that I've been in the program, I think have been obviously purposeful, but for a different reason than what I came to the program for. I think this is a part of why I came to the program, and I'm realizing that in this moment, I see myself as an advocate for those who are voiceless, and am hopeful that my research will help to make change in a different way outside of being an advocate in clinical practice and in the labor and delivery room, if you will, or through education and informing patients. But this right here is this is it. This is it for me, that I am, as a nurse midwife researcher, I am taking my practice, I am artistically working through my research to translate the longings of the heart of the people. That's it. That's what I seek to do. And to take their rage, to take their feelings of being neglected, their feelings of being abused in situations, their feelings of, or their realities, I should say, of being abused, their realities of not having access to quality health care, their challenges with getting to their appointments, their issues with stigma that comes from being mistreated, or that comes from providers that look at them differently and treat them differently because of their current situation. I want to take all of that and use it to transform the kind of care that they receive. I just wrote a piece, actually. I did a piece with Kiala, looking at how we teach and how we include, or I guess educate students, nursing students, around social determinants of health, and the importance of making sure that students come away understanding this, what patients bring to a situation. And so often we have challenges, or I've seen or experienced situations where providers have been less than appropriate, quite frankly, in the kind of care and support that they offer to patients. Comments have been made that are completely out of line and inappropriate. That needs to stop. It continues to feed the idea that, in some cases, that Black people are uneducated, or that Black people can't do for themselves, or that Black people will never get it. And it feeds the way in which we care for them, increasing reproductive coercion, where we're forcing contraception, and I should say contraceptive coercion, where we're forcing contraception on people when they may not want that for themselves. So I could go on and on. I'm going to stop right there. But thank you. I think that's how I see it. I see the work that I'm doing as a combination of being that artist and being the activist. I hope I didn't go too long there.
Actually, I really love what you said, Kelley, because I'm not a frontline healthcare worker. You are. And the research that I look at looks at community health workers as frontline healthcare providers of a sort that is community-based and community-centric. And one of the things that strikes me about the use of community health workers is that, first of all, and I know I've said that this term, and for those of you who don't know what a community health worker is, they tend to be lay people who are either from the communities that they're serving, or they have a nuanced understanding of that community, either because they have the same kinds of health conditions or come from similar socioeconomic characteristics. And when you look at the workforce as a whole, most community health workers are low-income ethnic minority women. When we think about their incorporation into healthcare settings and the difficulties that they have encountered becoming part of a healthcare team, I've often felt that their BIPOC status is one of the things that hinders them from being fully embraced by clinicians or those who have higher levels of training. The reason I mention this is because when I think about the art of healthcare, I think about the fact that we live in it's not an increasingly diverse world. The world has always been diverse and people are just waking up to it. And especially the organizations that we're a part of are becoming more aware of it, which means that we need to learn how to, we need to figure out what is it going to take for these institutions that we're a part of to be more receptive to the voices of those that have been disenfranchised for so long and systematically and structurally silenced for so long. And when we think about community-based strategies to help facilitate that process, what is it going to take to value these types of interventions and give them the infrastructure that they need to thrive, so that by supporting them, we're also creating pathways to support the most disadvantaged populations that tend to benefit from their interventions. When I think about all of these things kind of put together, and just when I think about this from like a workforce development perspective, it makes me appreciate what Kelley said all the more, because I think that when we think about the art of healthcare, we think about things in a somewhat linear manner. And when we talk about things like social determinants of health, it's still kind of ahistorical and acontextual. We don't understand or notice that there are healthcare providers that are coming from the very communities that have been silenced, and that actually plays a role in the extent to which they are embraced by the dominant culture, which shapes the construction and then the delivery of healthcare. And so I don't have the answer. I'm posing all these questions because these are questions that I'm wrestling with. And I can tell you, okay, yay, I have a career development award. I'm looking at implementation science. Like, that's the formal way of putting it. But the heart of the matter is that there are these forces that people are contending with that are bigger than they are. And we have to figure out how to make all of these things work in a way that really meaningfully advances population health. And I think it will require even redefining what these terms mean, reimagining what these things are, and really just trying to figure out what it actually looks like to kind of uphold what Dr. Ahset, Amen, I hope I said your name correctly, because people mess up my name all the time, so I'm really sensitive to mispronouncing names. But what you really so eloquently stated about the role of the activist, and okay, thank you, put it in the chat box. But what the role of the activist and the artist is, I think it's a very, that the role that a researcher plays is analogous, and that, and then I also think too, I don't really, this is kind of on a personal note, I really came into this work because I always felt like I heard all the negative stories about what Black people are facing. And I always just felt like there has to be more to it than that, because when I look at my family, they're able to galvanize resources within themselves and within their communities to help one another. And when I look at other communities across the African diaspora, it's the same thing. And sometimes the extent to which that happens can be constrained by economics, but by and large, people are finding ways to help one another. So the thing that I really wrestle with is this idea of being an advocate and not being a gatekeeper, not subscribing to some form of distorted respectability politics that says this way of helping is more valid than another way of helping, but that instead I'm taking into account all these very valid ways that people convene to support one another and to support each other's health. And again, I'm not saying this because I have the answers. It's just something that I think a lot about, because I'm aspiring to be a community engaged researcher, and I don't want to just be that by name. I really want to walk that out in my practice of research. So those are some of the things that I think about that. And this has been such a great conversation for me to be a part of and to learn from other people, because I find myself being challenged even by the things that have been said to think through how can I deepen this within myself and then help others do the same.
Thank you so much for that. And I want to highlight the language that you used around the practice of building safe spaces with each other, the communal practice. And that has been the way that I have experienced LaToya Peoples' work. I walk past some of her public work every day. Literally, it's down the street from my place. So LaToya, I would love for you to talk to us a little bit about the way that you've created safe spaces for young people with your mural work and the work that you do in schools.
Okay. Going back to that project, and then also other projects where I've worked with different communities here in Sandtown in Baltimore, but also in the Montbello community in Colorado, where I've done some projects out there. And so when I go into a community to work on a project, I try to approach it not about like what I think this space needs, and more so like engage with the community and bringing their vision for the work and like what they want to see in their community. So it's, when I was in Colorado, the space that I was in was like a public sort of park space. And it was, the Black community members coming in and having church services and barbecues and sort of inviting me into their space and me getting to talk to them about the vision for the artwork. And so also in Baltimore in the summers, I do a program called Art at Work, where we recruit youth from the communities where our project sites are going to be, and we work with them over the course of 8 weeks to create the project. We canvass the neighborhood, we talk to, we have the kids interview people, we collect all the information, and then we design the project with the students. They get, to learn the process of mural making and that whole thing. And so it's sort of allowing these youth to put their voice, their resistance, their movement into creating works that reflect their community. And so I think that public art specifically sort of creates a feeling of safety. It's like an implied safety. It's tied to value. And, when you go into a neighborhood where there's lots of public art or, there's sort of that visual care of the community, it sort of creates that feeling of safety. And I think that a lot of the sort of history involved with communities where Black people live, they weren't designed to make Black people feel safe. And so going back to the project at the hospital in the behavioral health unit that serves mostly people of color, mostly Black people from Baltimore, when I was designing the images for that project, I submitted my sketches to the powers that be at the hospital. And, when I made the sketches, I used sort of very generic, androgynous, raceless people. But then when I painted the images, I was intentional about painting Black people. I paint Black people. And I, in thinking about how I was going to create those images, I was thinking about, being a patient there and, possibly having psychological challenges or challenges with substance abuse and really trying to heal and being in a space that was, filled with people who didn't look like me may not be a optimal a space for my therapy and my healing. And so of the 6 artists, I think it's kind of funny to think about it now that I just realized, but the 2 Black women on the team of artists, we were very intentional about painting Black people, specifically Black women, whereas everyone else sort of more had wanted a general appeal in terms of the imagery. And so I thought that was important to create these images so that the patients there would see them and can imagine themselves as peaceful, as growing, as capable of growth, as beautiful, as worthy of healing. And I'm hoping that that's what it's doing. So, yeah.
Well, I believe that that's what it's doing. That's the way I've experienced it in the community. And that is the way I have experienced this panel. It is hard to believe that we're already out of time. And I am thankful to the folks who stayed around all the way until the end. I am now borrowing time from you that I did not ask for. So thank you for your generosity. We may have to do a part 2. This has been phenomenal. And I feel like we're just getting started. So thank you to everyone who came and has enjoyed this conversation. As always, I ask you to think about what your aha moment is and what you can commit to after hearing this conversation. And we'll just keep you posted perhaps for a part 2. Thanks and have a great day. Thanks so much to our panelists. Appreciate you and the work that you do. You're invaluable.
Thank you.
Thank you.
Thanks.
Yeah.
If any of you have information that you want us to make available to folks who attended today, LaToya, I put your Instagram in, and the link to the Billie Holiday Project, Kali-Ahset. But if you want folks to follow you on social media, if you want them to be part of any of the work that you're doing, even Kelley with your research, please let me know and I can send it out in our follow-up survey. Thank you.